Welcome to the podcast series, Sinan, brought to you by Heidelberg University's Graduate School for Humanities and Social Sciences. Tune in for thought-provoking interviews with experts in different fields, from the social sciences to the humanities, from law to economics. Hello and welcome to the HGGS podcast series, Sinan. In recent years, humanity has experienced one of the most significant global crises in modern history, the COVID-19 pandemic. The crisis offered us a direct and sobering insight into how infectious diseases can alter the trajectory of societies and reveal the persistent fragility of human systems, despite the technological and scientific advancements we possess today. At the same time, global inequality remains a pressing reality. It is an uncomfortable but undeniable fact that certain regions of the world are disproportionately affected by specific diseases, often due to historical and structural conditions beyond their control. When it comes to one of the most serious global health challenges of our time, namely HIV, it is evident that substantial efforts are still required to develop sustainable and practicable solutions. To share her expertise and insights on this highly relevant topic, we are delighted to welcome a prominent guest, Dr. Maureen McGowan, from the Heidelberg Institute of Global Health at Heidelberg University, and a second affiliation, also from South African Center for Epidemiological Modeling and Analysis at Stellenbosch University, South Africa. Welcome, Professor.
Thank you. Thank you so much for having me.
Well, traditionally, we start with asking our guests about their academic background. So I would like to start with asking your academic background.
Sure. So I had a bit of a funny way into getting into global health. So I actually started in early childhood education in my bachelor's, and I was meant to become an English and a math teacher. And after 2 years, I ended up switching to psychology. And I have my bachelor's in psychology, which I did in the US. And then I did my master's of global health in Maastricht University in the Netherlands, my PhD in Germany, now also in global health, and now my postdoc, as you'd already mentioned, with Heidelberg as well, Stellenbosch University.
Well, it sounds like a really interdisciplinary background. And
Yes.
maybe also that can has traces of the choice of your research that we are going to talk about today, which is the topic of HIV prevention in Sub-Saharan Africa. So looking back on your academic trajectory, which intellectual, professional, or personal experiences inspired you to dedicate your research to HIV prevention, especially in Sub-Saharan Africa?
Yeah, so I actually have two reasons I kind of got into HIV. So one was through my bachelor's. I had this opportunity to do like a student research job, and it was in a health psychology lab in Maryland. And they were looking at the time at HIV prevention and prenatal care for Haitian women. So that was my first exposure to it. And I just found it very interesting because I feel like HIV is one of the few infectious disease areas or disease areas that has like a very psychological part, a social part. So it's not just the disease itself, but it's also all these factors around it. And then after I graduated my bachelor's, I went to Peru for 3 months. I worked with an organization called Proyecto Peru, and I was in a clinic there. And I was trying to decide at that time if I was going to be more in the psychological realm, if I was going to go into nursing or pre-med or any of those. And I had realized that a lot of the patients we saw were there for preventable causes. So because they didn't have the vaccines they needed, many were there for parasitic infections from not having access to clean water. So at that time, I was kind of looking at how can we look at it from the prevention side? And that's what led me into global health later on.
Right. And
Yeah.
it's also a really great time to delve into the fundamentals of this topic because we are talking about a really complex problem here. Current challenges related to HIV in Sub-Saharan Africa. So could you elaborate on the key factors that contribute to HIV remaining a major public health challenge in Sub-Saharan Africa?
So that's a complex question. There's actually many different factors. So I actually had to take note of a few of them. So they're not in isolation, but some of it you could look at it culturally. So one thing we're seeing right now in Sub-Saharan Africa is that the most new infections are happening among what we would call AGYW. So those are adolescent girls and young women. And these are typically girls between 15, 16 to 24. And they are engaging at times in multiple partnerships, or we're seeing sometimes partnerships with older men, transactional sex, and that's a lot of times also because of the financial situation they're in. So we see that. And on the flip side, we see with men, depending on their country and culture, not all men by any means, that might have multiple partnerships because that's culturally appropriate. So there's these various factors happening culturally. We also see like limited access. So limited access maybe to sexual health education, challenges getting to clinics or getting the products they need for tests. And even as simple in many of our projects, we see that people don't have the money to pay for the bus to get to the clinic. So it's even into that area. And 2 or 3 more points I'd like to talk about factor-wise is that there's limited funding right now in the HIV world, particularly since last year, since the US funding cuts. A lot of the projects we did have are no longer running or in very limited capacity. So that's all been reduced. And on top of that, we can't forget stigma around HIV. We see stigma even here in Europe for people that have HIV, but even more pronounced in Sub-Saharan Africa. So I think it's really challenging to tell an individual to go test if maybe they're scared of losing their partnership or their family unit or their kids, or what if I lose my job? So I think it's a lot of pressure to actually go and test. And lastly, I can't forget about the punitive laws that we see, particularly in some areas of Sub-Saharan Africa, where there can be arrest or even death penalties in cases of same-sex partnerships or arresting for sex work, drug use, and sometimes arrest for things called when you're like transmitting HIV. So then it gets into a murky realm of did the person know they had it when they had sexual relations, and transmission laws as well. So I think when you combine those, it's a very challenging situation.
I guess apart from this, I would say, disturbing cultural and legal factors, financial side, the international
Yeah.
cooperation in order to overcome this problem also plays a great role there. And if I understood correctly, the situation in terms of international funding is not getting better.
No, it's getting worse, if anything. But one thing I'd like to say before we move on to the funding thing, I'd also like to highlight that while there's all these factors and challenges happening, the trends are improving. The countries are working very, very hard to reduce the new HIV infections. So it's come a super long way, but there are still these challenges. So I'd like to highlight that.
Yeah, wonderful.
Yeah.
At least we have a light at the end of the
Yes.
tunnel, of course, as always.
Yes.
And also your research highlights disparities in HIV exposure between men and women. So maybe gender politics comes into the stage at that point. I know that it's not really at the center of your research, but to have a general picture about the factors that are playing within this disparity of the man and woman. So what factors are playing especially a role here to explain this gender-related differences and also age-related differences?
So as you said, this is not exactly the center of my research to compare those different groups and the different age brackets. So I know there is some research going on about that. From what I can say, based off of my personal research, is, as I'd mentioned, there's also the cultural differences and gender norms in various countries of what is expected of a woman versus expected of a man in terms of partnerships. And one point I hadn't mentioned already is that, well, I'm currently working on a men's study, so my focus right now is a little bit there. But men often feel excluded from the healthcare sector. I think that's one of the very few areas in society that's more female-dominated and female-oriented. So, women might have more entry points into the clinic, let's say through prenatal care, antenatal care. They take their kids to the pediatrician. Most of the nurses are female. There is a level of men feeling that they can't go when they're surrounded by women in the waiting room, when the doctors and the nurses are women. So I think that's playing a major role there. And with the age brackets, that's actually a really hot topic right now that people are looking at where the trends are coming from. Why are they changing? One assumption I have, I guess, based off some research I've been reading, is that because people are living longer with HIV, because now they have medication, they can have a long life. In the past, that was unfortunately not the case. So now we do have a whole population of older individuals with HIV, which wasn't the case before. So now we also see relationships between young women and older men. And so there is some assumption about the crossing of age groups, and that's why we might see some higher levels among the young women.
Yeah, I see. And we are going to focus more on the adolescent girls and young women, actually, because you have conducted an extensive research on this portion of the population. But of course, we can also bring your expertise on the studies of the men.
Yeah.
So I'd like to also continue with one special aspect of your research, which is peer referral among adolescent girls and young women. And you have conducted research on the concept of this peer referral. And first, I'd like to maybe concretize more what should we understand under this term, peer referral and how it may serve as an effective strategy for raising awareness and reducing HIV-related risks.
Yeah, so peer referral is kind of the whole basis of my PhD. So it basically can be thought of as friend referral, if that's helpful to put it into terms. And I use the example a lot of times of COVID, actually, to put it into context. So, for example, with COVID vaccines or COVID testing, we saw a lot of people being distrustful of the vaccine. And, the politicians can say something, the doctors can say something, but there's a lot of mistrust. But when a friend or a family member says, hey, I took this and I'm okay, or I really had a good experience with this, it's much more impactful. So that kind of is how you can maybe think about the HIV peer referral. And in that, we basically trained a group of women, young girls, so they were 16 to 24 as well. And we trained them on how to use an HIV self-test at home. And then we said, can you give these to a few of your friends? And we gave them the packets and then told them if it's negative, you could go to a clinic and get PrEP, that's the prevention medication, or if it's positive, you should get the other test, see if you can get on treatment. So we found that to be very effective. I think in that study, it was a pilot study, it was over 90% said they tested and over 80%, I believe, said they took the prevention medication. So yeah, that's kind of what that is.
That's a really significant finding, actually.
Yeah.
And maybe that can also play a role in terms of overcoming this mistrust, which takes the center place, actually, when we are defining this problem. So maybe would you concretize more what recommendations would you propose to strengthen peer referral mechanisms among adolescent girls and young women?
Yeah, that's tough. I think there's a few things we could do. I think one, you'd touched on funding. I think we need more funding behind these type of community services outside the clinic. And I think it's also recruiting perhaps the right people and providing them the training. So I think it's at first building up this network. And then I also thought of a few other things we could do. One came from perhaps, this sounds a bit odd, but perhaps trying to recruit outside of the normal group in the sense of I was working with female sex workers as my study. And a lot of these women that we used as peer educators were recruited to us through like these female sex worker organizations. So they were known sex workers in brothels and bars, but we couldn't access the women that were working on the street. So I think if you were to find the right people working on the street, they could also access those networks that we typically can't. I don't know. I think those are the main ones. Perhaps also some level of using social media or phones. There was some recommendation to use maybe networking through WhatsApp, social media, especially if we're trying to reach the young girls. So those are just a few that come to mind.
Actually, using social media and phones could be a really good way to communicate with the young generation, when it comes to talking about this trends actually in today's world.
Yeah.
And maybe related with what we have talked about, the role of social support, also really important in HIV prevention. And you have highlighted the importance of social support. And this social support can take various forms depending on specific needs. And within your research on female sex workers, you classify it as informational, instrumental, and emotional support. So could you elaborate on how these different categories of social support can be correctly concretized in the context of your research, of course?
Yeah, definitely. So as you mentioned, there's various forms of support. So in this study, we were looking at how those forms of support can work or hinder in either case. So a lot of times, depending on how people present things, it could be taken either way. And what I mean by informational support is really the education and training. So when someone actually teaches you, this is an HIV self-test, and this is how you use it, and this is how you interpret it. So there's that information that's shared. There's also instrumental, which can be thought of the instrument itself or a physical thing. So in that study, we saw, for example, that sex workers were very clever in how they would pool their financial resources and help someone pay for a bus ticket or so to go to a clinic. So that could be the example there. And finally, emotional support is kind of as it sounds. It's encouraging. It's telling them, I used it and I'm okay. It's really just basing off that emotional aspect. Like I said, it could go either way. So if you have a woman, in this case, a female sex worker who had a really bad experience, we saw that very quickly spreads through the friend group as well. So it can go either way.
As a follow-up question, I think there's a really big difference between, in terms of this social support, interfering with the lives of the society, like with a direct interference, and also teaching them how to do it or like kind of educating themselves. So what would be your comment on this maybe interpretation of the social support and which ways are more effective in terms of preventing HIV?
Yeah, I think that's a good question. I think the training is the basis. So when you build up this type of system, you have to make sure what you're teaching or training them on is correct and also addressing that misinformation. Just an example I can use from here is there were a few women, for example, who were scared that the test would give them HIV. And when you have that type of misinformation, it can spread very quickly. So being very receptive to their concerns, even if for us it would make sense, like, oh, that can't be the case, but really talking about training. I think that's the main point I would have there with the recommendation is the training and adapting as you go based off of what they say and, learning from that.
So our main takeaway is training
Yeah.
plays the
Training-
central,
Training and perhaps incentives.
Incentives, yeah, sure. of
Because,
course.
especially in these communities, there has to be an incentive there because these women often are coming from areas of poverty or in the same we're seeing in our male study that there has to be an incentive aspect because it has to be worth their time. They're taking off work or they're taking off school to do these trainings and to take part. So.
Well, it's totally understandable. We are also talking about a really complex problem, as we have mentioned, and there are different stakeholders. And you have mentioned about the importance of voluntary assisted partner notification. But first of all, I'd like to start with naming the stakeholders and which stakeholders are actually playing a role in terms of overcoming these underlying challenges in HIV prevention, so that we can also first maybe understand what the problem is. Which stakeholders are involved in this problem, and then we can also talk about the solutions as well.
And I might just briefly explain what voluntary assisted partner notification is, because I know that's a bit of a mouthful, so we just call it VAPN sometimes. And that's basically just the system or guideline that's in place when someone goes to a clinic and tests positive, that your provider will ask you, who have you had sex with in the last 6 months or 12 months? And they'll write down the name and contact. You then have the choice as the client or patient to go to that person and say, hey, you need to get tested, like you would see in partnerships sometimes. But where the healthcare providers come in is that they can also offer an anonymous service and say, you get a call and say, someone have just been tested positive, you might want to get tested. So that's what that's about. And it's very controversial. It's been used a lot in Europe and the US, but particularly in Sub-Saharan Africa, it's quite controversial about that system of having to give someone's contact information. And the stakeholders that play a role there, as with, I would say everything, with HIV prevention are anyone from the client or patient themselves to the healthcare workers, community healthcare workers, ministries of health, various civil society organizations, advocacy groups, and then up to the global level. So in this study, we didn't have the clients or the civil society organizations, but we focused mostly on the global actors, Ministry of Health, and the community health workers.
Of course, there's a regional part of this problem, and we have focused on only the Sub-Saharan Africa, but I think there is also a transboundary aspect of this problem, because when we are talking about disease, normally it's not really contained in some part of the world itself. So international cooperation should be also one of the key factors that has a really important place there. And I'd like to also move on with this stakeholders' understanding of this issue, because you have highlighted the importance of putting all of the stakeholders, I would say, in the same box so that they have a common understanding of the issue there. So what would be your observations in terms of the factors playing a role here in the engagement of the stakeholders in the process of VAP?
So the factors that are playing a role there, I could maybe speak to what's working. I think when you do have some kind of space for it to have them in the same room, whether that's virtual or in person, on the flip side of that, what hinders it is, I think, this fragmentation between levels. So a lot of times, even if it comes with the best intention, I'll say, sometimes the global organizations have, a new guideline that they say, for example, VAPN, it's worked great in their minds in the Western countries. And then they quickly say, okay, well, now we're going to implement it in the global South. And in the case of VAPN, they actually put a lot of funding behind that. So they said they had to implement if they wanted to keep their funding going. So there is kind of that fragmentation between the levels, especially when you talk about client level or community health worker level and the global level. So there seems to be a breakdown somewhere between over the Ministry of Health and then from up to bottom. Yeah, and I think in that case, we need to do a lot more bottom-up work, particularly in regards to guidelines. And, if they're developing guidelines to say, this is what our idea is, how could you implement it on the ground and what's realistic? So I think that's really needed.
Yeah, it's a really challenging task, actually, when it comes to building up a bottom-up approach here. And the frequently discussed issue in public health is the gap between scientific research and policymaking. Maybe we can also relate that problem, the issue of bottom-up approaches versus top-down approaches, in this framework, this gap between scientific research and policymaking. And we usually observe that scientists and policymakers may struggle to communicate effectively, which can hinder both problem recognition and implementation of solutions, of course. So have you encountered this challenge in your work?
I think that's kind of the age-old issue. I would say the most I've observed it, I guess I'll say, is the VAPN one, where our research was showing that it just, from the stakeholders on the ground, it wasn't working for the most part. But the global level was saying something very different. So we saw that disconnect. I think I've seen it, but I haven't worked too much with HIV in policy. I've done more policy recommendations actually through Global Health Hub Germany on migrant health. So I've worked on that side a bit. But I think there it kind of comes down to, again, of how can we make that space to actually have them in the same room? And I sometimes have wondered whether, for example, if a Ministry of Health is eager to make a guideline, whether they could almost put a call out or have any researchers worked on this topic. And I wonder if it'd be possible to bring that evidence-based research with them. So I think it's kind of being invited to do those things. But at the same time, I do think researchers or advocacy groups also needs more work done to advocate to have the evidence put into policy. So I think it kind of goes both ways.
Yeah, sometimes we are always dealing with the theory of the problem and then forget how to implement it. Yeah, how to put it into practice. Yeah, that's a really important takeaway, actually. And one other, maybe I would say, sensitive issue here is ethical considerations, because given the sensitive nature of HIV prevention research, ethical considerations are of paramount importance. So what type of ethical challenges should be taken into account when working in this field, and what would be your recommendations?
Yeah, I think the ethical challenges are particularly important with HIV research, particularly confidentiality and anonymity. And you have to be very, very careful about people accidentally disclosing their status because they may not want to or can't for safety reasons. So I think if someone's interested in going to this research, to take particular focus on that. So it can even take the forms of recruitment, for example. So in some of our studies, we see that when we send out the research vehicle and go home to home, as you would do in other studies, that's not possible because right away this individual will be labeled as likely having HIV. So you have to go through a whole idea of how can you recruit the person in a way that's safe and hidden, perhaps, depending on the study. You have to also take into consideration when you give someone the pamphlets and information about the study or the materials like HIV self-tests or the medication, even something as simple as an information form can put someone into a dangerous situation. So you have to kind of evaluate if this person would be safe to go home with these materials. Can they keep it at home? How do they discard of it? Those type of considerations. Those are the ones that come to mind as of now.
Sure. And you have emphasized the importance of these cultural issues that are playing a role in the background, maybe, and international collaboration is often essential for addressing these complex cultural issues. And also, it's always a good idea to have an international team because it also brings some kind of different expertise that we haven't thought about. But working within international teams or in an international setting can be a little bit challenging sometimes because everybody has their own perspective. So in your experience, what skills or competencies should the researchers develop to ensure effective and respectful collaboration?
Yeah, I think it's about, mainly it sounds perhaps a bit obvious, but maybe kind of open communication and being open to constructive criticism. One example I have from the very beginning of my PhD was I've been told that, being half American, that Americans tend to think out loud and keep talking, and then they come to the conclusion. But other countries, and some of the countries I've been working in, they tend to have very long pauses, which is sometimes uncomfortable for others because they're thinking of the perfect answer. So I think it's sometimes giving that space to let the other person have the space to think about their response rather than one person just dominating the conversation. And then, it's being open for criticism. I think it was the first time I was in Uganda or Zimbabwe, I'm not sure. And I had told one of my colleagues who'd been there multiple times before, please, if I do something that's inappropriate or culturally inappropriate, I'd rather know and try to fix it rather than make everyone uncomfortable for my duration of that stay. So I think it's kind of being open to that criticism that we might not know every culture, but it's, you can learn from it.
But we can ask.
Yeah, we can ask.
Whether it's appropriate or not. So yeah, I totally agree with that. And maybe focusing on the interdisciplinary approaches that plays a role in the HIV prevention, because HIV is such a complex topic that has many multifaceted issues that requires contributions from various disciplines. I can also name some disciplines like biomedical research, social sciences, and policy studies. So how would you assess the importance of interdisciplinary approaches in your field?
I think especially for HIV prevention, it's necessary. So as you said, it begins with, the biological or the medical sciences, clinical sciences, when you really look at the disease itself and the medications and the large-scale trials. But when you get into the prevention side, it might be more of public health, global health. I tend to work with a mix of researchers on most of my projects. So even in the research side, there can be quite a diverse mix. So we typically have a number of qualitative researchers, quantitative modelers, epidemiologists on the team. And we typically always have social workers or one psychologist on the team. And that's also just for safety reasons. So depending on the study, you typically need a social worker or a psychologist who does the recruitment, the consenting, sometimes the interviewing, but also that pathway if there were to be an adverse effect. So if, for example, the person reacted badly to the medication, who do they call? Or if they were to experience violence at home because of the intervention you did, there needs to be a contact for that. So we usually have quite diverse teams. Yeah.
It poses a different challenge because you have to talk many different languages, not in terms of
Yes.
literally languages like
Yeah.
English, German, or
Yeah.
in the Sub-Saharan Africa, the other language, but the language of policymaking,
Yes.
for example, or more technical language of the public health issues. So I think that's a really
Yeah.
big challenge to overcome. But
Yeah.
yeah, you have also brought your experience in terms of overcoming these challenges.
Yeah, I think you're right. I think there's a few different language or types of language used. Typically, I am with the qualitative team, though, so we have very similar ways of talking. But even the qualitative team, we have some that are more on the thematic, theoretical end, and then we have some more that are more on the implementation science end, which would be really the people. That's kind of more what I do, but where you really look at what are like the outcomes and how can you improve the outcomes and stuff like that. So even there, you have different language. But
Yeah. And when you attend an interdisciplinary conference, you spend the first week just to understand this language of the other disciplines. So I cannot really imagine the challenges that this brings with it.
And as you mentioned, I mean, even not just the technical language, but really it is other languages too. So we have a very multilingual team. So that's on top of it.
And also like legal language is...
Yeah, that too.
Yeah, it has totally different structure. So yeah. And also talking about these languages, you have briefly mentioned about this qualitative research because you employ qualitative methodologies also in your research. And you have contributed the training of the young scholars and how they actually manage qualitative research in your field, of course, but in a more broader framework, how to use qualitative methods in the social sciences or maybe humanities as well. So what key considerations should early career researchers bear in mind when conducting qualitative research in public health? But I have to say that normally it takes like many different workshops to understand this. So I'm just asking you to maybe share with us the outline of the structure.
Sure. Yeah, I think first I would just encourage early career researchers to try out qualitative because I think there's been at least a long time in the sciences it was really quantitative heavy and qualitative was kind of always not really regarded as a strong method. But I see, especially in the public health, global health field, it's becoming more and more that you kind of need to have both sides of it. Like the ones showing the trends and the various hard science behind it, but then you also need the qualitative side to say why may have this happened or why may have not happened. So I would encourage early career researchers to take a look into that. I would tell them to bear in mind that it's quite various methods, but they're all quite complex and time consuming. So it's not this super easy method to do or easy approach to do. But I do think the beauty of qualitative is you can really understand better the individual and the culture and that specific client or participant group that you might not gain from other methods. So I would really encourage them to look into it.
Maybe it would be a controversial comment from my side, but sometimes when you quantify things in the scientific research, it can also lose its, I would not say importance, but this, I would say, indication value. So that you just see numbers, but you cannot really understand the emotions behind it or what these people are struggling actually in the background.
Yeah, I definitely agree because I think, working on a quant and qual team, so the quant people I think are so important to get like an overview of the trends and what's happening with this intervention and to see, is it working, is it not? Are people using the tests, are they not? So they're really important at showing that large scale part. But I would say the qualitative interesting thing is, like you said, you can really talk to that individual. And that's where you see a lot more emotion come out around, I can't use this medication because of whatever. And some of the stories are quite challenging, to be honest. So some will say things like that they're scared to go to the clinic and they can't use the medication because they're scared their partner will, I don't know, kick them out or harm them or whatever it is. So I think that's where you can kind of nicely balance like the larger scale and the individual. So I think that's a really important part.
And also one of the advantages of conducting a qualitative study, I would say that it reflects the heterogeneity of the society that you are actually conducting
Yeah.
research on. You cannot really see this heterogeneity. And of course, there are different kinds of quantitative studies. I'm not trying to only criticize the quantitative studies and also praise the qualitative one. Of course, they have different roles in the academia, but in order to understand this heterogeneity, it's really important to have maybe it's a little bit longer than the quants themselves, but to understand how these heterogeneity actually takes place in the society.
Yeah, definitely. I think even within what we would think is a homogeneous group, so I'll just use the example of the young women. You know, it was a group of girls 16 to 24, all from a similar region in Kenya. So you think kind of, okay, it must be similar. But it's not. So, you know, they each have different cultural backgrounds, tribal backgrounds. They spoke different languages in part. We saw, I think, I don't want to be misquoted, but I think I saw it was around 20% were already mothers as adolescents or young women. Actually, may have been up to 50%. And then I think it was 20% were engaged in sex work, but didn't label themselves as sex workers. So you do see like in these groups, very diverse change. So I think that's why it's important to talk to the various individuals to get a picture of what's actually happening.
Actually, based on what you have explained, it's also a really difficult task to approach these people when it comes to this complex issue, right?
Yeah.
And what will be your methodology? Because you are conducting a research and at the end of the day, you have to have a valid answer, a reliable answer from the research group that you are conducting. And what will be your approach actually in order to have the honest answers? But it's also challenging because, how do you put into an appropriate language actually?
Yeah. I think for those examples, especially in Sub-Saharan Africa, where I've been doing most of my research, it's all about really working alongside the local researchers because they're really the experts. I mean, they live there, they work there, their whole lives have been there in part, and they speak the local languages. They, also look like the people there. So there's a lot more trust. So I typically work, to be honest, more on the analysis end. And it's mostly my colleagues who are out there, doing the recruiting, talking to them, doing the interviews, just because there's so much more trust there. So I think that if you're going into this type of research, I think that's something to keep in mind is the local partnerships are pretty much the only way you can successfully do that research.
Yeah, I understand. And thank you so much for this wonderful interview.
Oh,
I
thank you.
enjoyed it a lot and I hope that also our listeners have enjoyed it a lot. And traditionally, we ask for your personal reflections at the end of the episode, and I have prepared you two questions. The first one is also a challenging one for me because we have also talked about this heterogeneity and homogeneity of the societies themselves. So I formulated this question in a way that maybe a culture is homogeneous, but of course, please take in mind that every culture has many different elements in it. But you have conducted a research in a different cultural setting, in different cultural context, and working with individuals from diverse backgrounds, worldviews, and daily realities. And at the same time, every culture is, of course, as I mentioned, internally heterogeneous. So what personal insights or reflections have you gained from conducting research in different cultural settings?
Yeah, I've thought about that question quite a bit. So I've had the huge privilege, to be honest, to be able to work abroad as much as I have. I've worked in Peru, in Curacao, Kenya, South Africa, Zimbabwe, and did some short-term courses in India and Uganda as well. So I've had quite a lot of experience there. It's hard to say, but I think my major reflection is, on the one hand, I'm always surprised how similar people are around the world. And it was kind of fitting. I was thinking about your theme, the us versus them, actually. And on the one hand, I think there's this tendency in the global north to say, we're so different from people in the global south. But at the end of the day, maybe in different strengths or in different experiences, we all have the same things that bring us joy and happiness, but also the same things that bring us stress. So, people are always worried about their jobs or their family or stuff. So at the end of the day, we're all just people. But with that being said, I think what I like the most is that each country is so different from one another and so unique, from the languages to the clothing to the dance styles to everything. And I think one of my favorite examples from that was working in Kenya. And then I was there for 3 months. And then I went over to Uganda only for 2 weeks. And they're neighboring countries. So in my ignorance, I was like, oh, it's going to be the same. It was not the same at all. There was just completely different from the way people interacted. The languages they spoke were honestly completely different. So Yeah, that was a really fun experience for me.
The world is immensely rich
Yeah.
in terms of culture and diversity, and that's what makes it beautiful, maybe.
Definitely, I totally agree.
Yeah. And also, finally, would you like to share your future research plans and the areas you hope to further contribute to within academia?
Yeah, so I think I had alluded to it, but my current research is actually, again, on peer referral systems. But this time I'm working on a very large trial with partners in South Africa, UK, and Zimbabwe. So it's based in Zimbabwe, and it's working with adult men and looking at their peer and friend networks. And can these carry over into men's groups? So that's what we're doing right now. And then my future dream project is to work a bit more in HIV prevention, but its intersection with menstrual health and menstruation. So I've started that research a bit, and I actually just have a master's student who joined me now who's going to be working on that project with me. So that's kind of a dream future direction I'm going.
But that's a great step forward, actually.
Yeah.
We are looking forward to learn more about your future academic endeavors. Maybe we will
you.
also have a chance to talk about them.
Yes.
Yeah.
Once I have more.
We're really happy to have you again in our studio and also talk about these projects. But thank you so much for today, for today's recording, and also giving us an opportunity to share your insights with our listeners.
Yeah, thank you so much. It's been really fun, and it's been great to talk to you. So I really appreciate the invite. Thank you.
With this wonderful comment, we are closing our episode. And if you liked our episode, please don't forget to check our previous episodes. So Dr. McGowan and I are saying goodbye to you.
Goodbye.
Goodbye. Thank you for listening to the HGGS podcast series, Ascendem. In this series, we bring you conversations with experts from a wide range of disciplines, from the social sciences to the humanities, from law to economics. If you enjoyed our podcast, we invite you to explore our previous episodes and subscribe to our channel so you never miss a new episode. Stay tuned for more insightful interviews coming soon.